Lifting family, welcome back. So, do not have that new microphone set up quite yet, but this video I wanted to go over some of my training. This day is actually a day that I've tried to kind of keep covered just because it's not super impressive, but for people that are dealing with back pain, I'm not saying that this is something that you should do, but this is just my take on it and how I am going about trying to make sure that my back pain stays at bay. I'm actually doing movements that will help myself improve upon lowering that back pain and hopefully having it go away to a very minimal level, and then also the associated hip pain that I've been having for quite some time now. So in terms of the training itself, starts off fairly simple in terms of the supersets. I really like supersets just because I can get more work done in those, and I tend not to have too much rest period, so I end up going from one exercise to the next, and then I get a little bit of rest gain for those muscles to a certain degree with doing that second exercise, and then I can take a short break and then get back into it, or maybe do a couple more exercises, then a short break and restart it. We kick things off with a knee banded. So that little mini band is actually by Contraband Sports. You can definitely pick those up on Amazon. That mini band, the purple one, knee banded, doing some glute bridges. I like the peak contraction on this exercise specifically because it allows me to really help fully engage and squeeze my glutes to make sure that I'm getting them contracted. That's something where my glutes tend to be lazy, they're a little bit weak, and so with this movement and specifically holding at that peak contraction, I can really make sure that they're firing, I can really make sure that they're engaged. And then I pair that up with a kettlebell single leg deadlift, and with that I am ended up doing these with a slow eccentric, which is not super common when it comes to deadlifts, especially when you're lifting heavier weights. Most people will forego the eccentric portion to a certain degree just because that can have some issues where you can't necessarily maintain the best spinal tension and integrity. But with this, I'm actually doing some eccentric loading, so really helping focus firing on my hamstrings to really get them engaged, and then also just maintaining some core bracing. That's something that tends to get a little bit lax with movements, and people will actually disengage their core because it takes quite a bit of strength to be able to keep your core engaged throughout an entire movement. Most people are primarily focused on the major muscles that are moving and not necessarily on their proper positioning within a specific movement. So with these kettlebell single leg deadlifts, I really enjoy these just because the kettlebells set me up a little bit higher off of the ground versus doing them with a dumbbell. And then in terms of a barbell, that's something where I like the way that I'm in more of a neutral grip when I do these, and I can position those kettlebells a little bit closer to the inside of my foot, and then I can much more easily bring my hips through at the top. It's something where I'm more comfortable with this movement. I really enjoy this movement. From there, we end up moving into another deadlift, which is more of a rack deadlift, and this is a kickstand style single leg deadlift. So I'm actually doing these with some lever bars. I usually use this for a car deadlift attachment, and with this one I have to face the weights rather than face away because of how I end up doing the kickstand. That would end up bumping into the weights that are loaded behind me. So with this, I'm facing the weights so then I can actually do the kickstand, which allows me to primarily load that front leg, but also have some additional support so that I'm still able to maintain some balance throughout the movement itself. And then it really allows me to help load up this movement a little bit more than I could with just a single leg. So I'm able to do just a little bit more work, and this also still has a stability component to it. And then working primarily with doing things in a unilateral fashion, it allows me to really focus on that movement with that specific limb, and it really allows me to properly engage that rather than starting to shift into where my imbalances end up falling, and then I end up shifting into the stronger leg or the stronger position within a given lift if I'm doing them with both legs. Then I move that into a single leg reverse hyperextension. In terms of this is highly debated in terms of needing a swing at the bottom of this movement. I would never advocate that because you are essentially starting to swing and lever your spine. Your spine should be engaged. You should have, that's part of why you want to have intra-abdominal pressure when you're doing any sort of loading. This would be fairly similar. You want a flat back. You want to make sure that you are not arching at your lower back and then rounding at the bottom. So you don't want to have this mega arch to where you are going into a hip extension, and then your spine is arching upwards or extending. And then at the bottom of the movement, you want to make sure that you're not going into an extreme flexion of the spine. Your spine should stay fairly stiff, fairly straight, and then this should be mostly movement that is coming from your hips. I like to do, again, a peak contraction on these just because I don't necessarily find these too beneficial when I'm doing a slow eccentric portion unless it's loaded, and with these, doing them unloaded really helps me engage, and I can focus more on the peak tension of that aspect rather than focusing on slowly eccentrically loading, which with that I end up also starting to kind of slip forward a little bit or slip back off of the bench that I'm on, and then that becomes more of me trying to make sure that I'm keeping stiff elbows to help me stay braced on that bench rather than actually focusing on the movement itself. Moving on from there, we move into the final portions of the exercise itself, of the workout itself, where we are doing a Nordic curl. These are still quite new to me, so I have to do these fairly heavily assisted, and I like higher reps with these just because lower reps I end up starting to look forward to being done at 5 reps or being done at 8 reps. And so with 15 reps I can really focus on form, and that's the goal anyways, is 15 repetitions, but I may end up in a position where I end up doing 14. If my hips start to break where I lose positioning, I will not compromise my integrity or the integrity of my positioning to just essentially try to get another rep. That's part of how people get injured. That's part of how the injury happened itself in the beginning. I then move on into the glute roller. I actually like to do these in a elevated bridged position. So similar to how you would do a hip thrust, the way that I end up pulling the weight into myself, it becomes a little bit difficult the moment that weight comes all the way back. There's a certain lever point where you don't necessarily get stuck in that position, but it feels a lot more comfortable. I would encourage you to try this, and that you give it a try with a little bit of an elevated platform. Elevate your body up just a little bit and see if these feel a little bit better. It's much easier to keep the glutes engaged in this fashion, and you're not teetering on creating a crane-like effect that ends up happening where you have to maintain this elevation throughout the lift. It's much easier to keep your glutes engaged, and it's a lot easier to get this movement completed. And then from there we move into some foam roller. Just basically I use the foam roller as a positioning piece to allow my knees to stay apart a decent ways, but then just basically doing some adduction holds. Part of the issue that I have with my hip is that I also have weak adductors, and there's a slight strain that is going on with the adductor in my right hip. So just doing some isometric, isostatic holding with this is helping strengthen that, but also just more of a positioning piece to make sure that they can stay engaged and be more of a stability component rather than like an active or primary mover. They will stay stable and stay strong as I'm doing different movements. So part of the reason why I'm doing them in an isometric fashion. I am not advocating that you do any of this exercise unless you are deemed safe by a competent doctor or physician that would then allow you to do an exercise like this. But this is my hip pain, back pain, lower body leg workout.